Thanks for coming in. My name is Dr. Matt. I'm going to do your examination today. Alright. Can you please verify your first and last name and your date of birth? Okay. Full code. And do you have any allergies? So you're allergic to penicillin and seafood. Okay. Any other allergies to medications? No. Primary language is English, correct? Okay. Would you like to list a secondary language? Okay. Okay. And who is your primary care physician? Alright. I'm going to go ahead and ask a few questions about your medical history. And just tell me yes or no first, and then if you answer yes to any of the questions, then I'm going to go ahead and ask you a little bit more in detail about what is going on. Do you have a history of seizures? Okay, migraines. And when were you first diagnosed? 2007. Okay. Any history of just regular headaches? Okay, it's hard to tell. I understand. Do you have any history of Parkinson's disease in your family? No. Okay. Any history of respiratory disorders, breathing problems, shortness of breath? Okay. Any history of liver problems or thyroid? Okay. Do you smoke? No. Do you drink alcohol? Sometimes. Okay. Do you suffer from anxiety or depression? Okay. Do you wear contacts or glasses? Okay, so you wear contacts sometimes. And you prefer glasses. Okay. Were you ever hospitalized recently for a sore throat? Okay. You were diagnosed with strep. Okay. And how many days of antibiotics were you on? 10 days. Okay, 8 PO and 2 IV. Good. Are you experiencing any pain right now? On a scale of 0 to 10, how would you rate your pain? So it's about a 2 out of 10. And is your pain still in your throat? Okay. Okay. Any skin disorders? Any itchiness or dry skin? Dry skin on legs? Okay. Okay. Have you noticed any edema recently? Any swelling in your hands or feet? No. That's good. Okay. Any problems with your gait, the way you walk, any back problems? Okay. And let's see. And how would you rate your sleep pattern? Okay, so you can say yes, it's good. It's about medium, and no, I don't sleep well at all. You sleep well. Okay, that's good. You don't have any problems falling asleep. Okay. What about staying asleep? Okay. Do you wake up often during the night? About one time. Okay. And is it very hard for you to go back to sleep? No. Okay. I'm going to go ahead and put my gloves on and I'll take your vital signs. I'm going to put this inside your ear, okay? And I'm just going to go ahead and pull. Okay, temperature is 99.1. I'm not too concerned. Usually when we do take it in the ear, it tends to be a little bit higher than normal. Okay, and I'm going to take your oxygenation and your heart rate. This will go on your index finger. Good. So go ahead and just relax for me. Can you take a deep breath in? And breathe out. Okay. Oxygenation is 99 percentile on room air, and your heart rate is about 70 beats per minute, which is very good. You're resting, so it shouldn't be any higher or lower than that. Okay, do you have an arm preference? No. I'm going to take your blood pressure, and is it okay if we do it on the left? Okay, great. Okay. Now go ahead and uncross your legs for me. Thank you. Okay. Good. Okay. Very good. Blood pressure is about 121/75. Let's go ahead and slide this cuff down. Good. Now, have you noticed any arrhythmias? Any skipping beats of your heart rhythm? Okay. Well, I'm going to listen to your heart, so I need you to relax and just breathe normal for me, okay? Okay. Just relax. I can hear only S1 and S2, no S3, no S4. Can you please take a deep breath in now? And breathe out. Very good. Can you do that again? Take a deep breath in. And breathe out. Okay. And I'll listen to your back as well. Take a deep breath in. And breathe out. Good. And again, take a deep breath in. And breathe out. Okay. I'm going to tap on your chest just to make sure that you have no fluid built up in your lungs. And go ahead and relax for me, okay? Good. 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 Okay. And now I'm going to listen to your belly. Make sure that there are normal. Make sure that there are normal sounds. Okay. And can you lift up your shirt for me? Just up to the rib cage. Okay, good. Okay. Good. Good. Okay. Very normal bowel sounds. And I'm going to go ahead and just slowly palpate your abdomen. Let me know if you feel any kind of pain. Any tenderness as I'm doing that? No. Okay, very good. All right, and I'm going to go ahead and tap on your back as well, just to make sure that I'm not hearing any kind of abnormal sounds. Okay, you can go ahead and just relax for me. Okay, very good. And I'm going to check your legs and your feet for any edema and check your pedal pulses as well. So just relax over there where you are, and I'm going to lift your pants a little bit higher, okay, just so I can get exposure to your ankles. Good. And I'm just going to put 2 fingers on each foot to check for pedal pulses. 2 plus, strong and symmetric. Okay. And as I'm pressing down on your skin here next to the ankle, I'm not seeing any indentation, so no edema. Okay, perfect. All right, I'm going to go ahead and examine your head now, and I'll also make some movements just to make sure that you have full range of motion. So go ahead and relax. I'm just going to palpate here. Any pain as I'm doing that? Any pain now? Okay, what about now? Good. And now. Okay, excellent. And can you please follow my directions? Okay, I'm going to ask you to touch your chest with your chin, so do that. Good. Okay, any pain there? No. And now go ahead and hyperextend your neck, so go ahead and just look up, all the way up. Any pain as you're doing that? Okay. All right, and now come back to center, and with your right ear, try to touch your right shoulder. Any pain there? No? That's good. And we'll do the same thing on the other side. So with your left ear, try to touch your left shoulder. Any pain there? Okay, so you do have full range of motion. All right, I'm going to ask you to shrug your shoulders for me. Good. And I'm going to press down. Okay, that's good. And now can you please look right here for me? All right? Good. And now look right here. Okay, perfect. And can you please give me a big smile? And now frown. And puff your cheeks for me. Keep them puffed. Don't let me unpuff them. Excellent. And can you please close your eyes and don't let me open your eyes, okay? Okay, don't let me open them. Very good. And now, as you keep your eyes closed, good, I'm going to ask you to try to lift your eyebrows as high as you can up to the sky. Good. And I'm going to try to push them down, and don't let me do that. Okay. That was very good. All right. Can you please squeeze my fingers? Squeeze, squeeze, squeeze my fingers. Very good. And now I'm going to ask you to put your arms up like this, and I'm going to test your upper strength, upper side of your body strength. And okay, so as you have your arms like this in front of you, I'm going to try to push them down. Don't let me do that. Good. And now I'm going to try to push them up. Don't let me do that. Excellent. And I'm going to try to open up your arms so you can even hold them like this. Good. Excellent. And now I'm going to try to close them. Don't let me do that. Very good. Alright, and now I'll move down to your lower side. So we're going to do the same thing with your legs. I'm going to ask you to lift your knee up. And I'm pushing down. Try to resist. Good. Okay, so that was good on that side. And now we're going to do the left. So, the same thing. Just lift it up. Okay, wonderful. I'm going to take some measurements. And I'm going to first measure your neck. Alright, so go ahead and relax. Can you lift your chin a little bit higher? Good. Okay. Good. And I'm going to measure your head circumference as well. It is very important to take measurements regularly just to double check and make sure that there is no inflammation and also no changes as we go through the treatment plan. Okay. I'm going to go ahead and palpate your face to see if there is any tenderness and any pain there. Okay, what about here? Good. And here. Good. I'm going to palpate underneath your eyes. Any pain? Okay, and I'm going to check your lymph nodes. So, no pain there. I'm not feeling anything swollen. Okay, some mandibular lymph nodes are regular size. I'm going to palpate your preauricular lymph nodes, which I'm not even feeling them, so going to palpate your axillary lymph nodes as well. So I'm going to ask you to lift one arm up. Let's go ahead and start with the right side. And any pain? No. Okay. Go ahead and put your arm back down, and I will palpate your left now. So lift all the way up. Any pain? Good. Okay. Okay. Have you noticed any changes with your vision lately? Any double vision, blurry vision? No. Okay. All right. Well, what I'm going to do is I will do a very good examination of your eyes. Okay. I'm going to start with a light test, and I'm going to check your pupil size, make sure that it's dilating and constricting properly. All right, so for that, I'm going to have you look right here at my fingers. Good. Just keep on looking at my fingers. Good. And same thing on the other side. So I'm going to have you look right here. Good. Pupils are round and reactive to light and accommodating as well. Okay, now can you please tell me when you don't see my light in your field of vision? No? Alright, so that was very easy. I'm going to go ahead and cover one eye for you. Is that good? Okay, so go ahead and tell me now when you don't see my light in your field of vision. Now. 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 Okay? And let's go ahead and switch eyes. So we'll do the same thing on the other side. And tell me when you don't see my light in your field of vision. Now. 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 Okay. Alright, now I'm going to have you follow the light with your eyes only. Don't move your head, okay? Okay, keep your head straight and just follow the light. Good. Okay, now I'm going to do some peripheral vision tests. And we'll come back to the light in just a second. Alright, can you please look at my finger right here? Good. And I'll look at my fingers right here. Okay. And now can you please tell me which fingers are moving, right or left? Good. 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 Wonderful. Okay, now go ahead and tell me when you don't see my fingers in your field of vision. Now. 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 Wonderful. Okay, now I'm going to ask you to cover one eye, and we'll move to the Snellen chart over there and I'm going to ask you to read some letters, some numbers, and identify some colors, okay? Okay, let's go ahead and cover your right eye now, okay? Can you tell me what letter you see right here? Letter E. Good. So let's go ahead and move down to row number 2. What letter you see here? F. What about here? P. Okay. And now I'm going to move down to row number 3. Okay. Do you see this letter right here? Good. Go ahead and read, starting with the first letter to the left. T. O. C. Okay. And can you tell me, can you read row number 4? Gets blurry. Okay. All right, so we stopped at row number 3. Okay. Can you tell me what color this is? Good. And what about this one right here? Red. Excellent. All right, go ahead and switch eyes for me now. So cover your left eye. Okay, and I'm just going to ask you to read the same letters starting from the top. So E, F, P, T, O, C, M. No, it's not M, it's L. It's okay, no worries. F, it's not F, it's letter P. Okay, no worries, I totally understand. So it does get blurry with both eyes, starting with row number 3. And no worries, we can go ahead and keep on assessing. Can you please tell me what color you see? Just to make sure that your color deficiency is, you don't have color deficiency. Okay, so that's green, and this is red. All right. Then let's go ahead and switch to just closer, okay? So here I have almost the same thing. It's like a Snellen chart, and I'm going to ask you some colors and some numbers and letters to make sure that your vision is proper. But I have a feeling that you might need a new prescription for faraway vision, and let's see how you're doing here. Can you go ahead and tell me what letter this is? Okay, and what letter you see right here? H. What about here? Q. So that's good. Can you tell me what color this is? Red, yellow, purple, orange, black, yellow. This one right here. Green. And we're not missing anything, so that was good. Okay. I'm going to check your optic nerve now. So can you please look in the distance for me? Look at this straight at the wall. I'm going to come very close to your eye and examine your optic nerve. Keep your eyes open as much as you can. I'm going to ask you to do the same thing, so go ahead and look behind me straight at the wall. You can look at the red stethoscope if you want. vision is 20/70. To check your facial sensation, and I'm going to ask you to tell me where you feel me touching you on your face. I'm going to touch you with kind of a cold texture to make sure that you are able to feel the coldness. And for that, I'm going to ask you to close your eyes. Good. And go ahead and tell me exactly where you feel this on your face. Good. 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 Okay. Nose. Right eye. Forehead. Chin. Okay, very good. No abnormalities noted there. Now I'm going to check how your body perceives the outside stimulus, and we're going to have a very soft stimulus, which is going to feel just like this, and also a sharp stimulus, which is going to be a little bit painful, but not that type of painful. Okay, I just want to make sure that you do feel it. So it's going to feel kind of sharp. All right, here's one example. Okay, so you see, it doesn't hurt, but you do feel it in a kind of painful way. All right, go ahead and keep your eyes closed for me and tell me if you feel sharp or dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Okay, and now I'll go down your arms. Sharp. Sharp. Dull. 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 Okay. Wonderful. I'm going to go ahead and check your nose. Have you noticed anything abnormal with your smell? No. Okay. Can you go ahead and cover one nostril and breathe in and breathe out? Good. And same thing on the other side. Good. So your ears are patent and it doesn't seem to have any obstruction. So I'm going to ask you now to look up for me and I'll examine your nose. Go ahead and keep looking up. Perfect. Okay, well, with that being said, we can go ahead and do a smell test. And I'm going to ask you to take a deep breath in. Okay, as soon as I bring this closer to your nose. Okay, so go ahead and take a deep breath in. And breathe out. And what does this taste like? Apples. Okay. And I'm going to go ahead and give you one more taste, one more smell. Please take another deep breath in through your nose. And breathe out. Very good. And what does that smell like? Bananas. Exactly. So I do like to taste for apples and bananas on every test to make sure that I have a good baseline. Okay. Okay. Can you please stick your tongue out for me? I'm going to gently press down with my tongue depressor. Uvulus midline. Mucosa is pink and moist. I'm not seeing any deviation. Uvula is also midline. Tongue is symmetric. Tonsils are not enlarged anymore, which is good. And I'm not noticing any redness. Normal color, no signs of infection. Okay, good. All right, and would it be okay to do a taste check? Okay. All right, I'm going to put one drop on your tongue, okay? And I'm going to ask you to identify the taste. One tongue, one drop. Good. Can you please tell me what that tastes like? Cinnamon. Good. Okay. Okay, one more drop. Stick your tongue out for me. Can you please tell me what that tastes like? Okay. Strawberries. And I would like to try one more. Okay. Go ahead and stick out your tongue again. Watermelon. Okay. Okay. I'm going to go ahead and check your reflexes. Can you please lower your jaw a little bit? Just relax it, just like that. Good. Any pain there? Okay. And now I'm going to tap on your shoulders and the back. Good. On your elbow. Good. And your wrist. Okay. So good reflexes there. Okay, same thing on your shoulder. Good. Elbow. And wrist. Relax. Relax. Okay. And your knees. Relax your knees for me, please. Okay. Good. Relax. Okay. Wonderful. And I'm going to go ahead and check your babinski reflex. So just relax your feet for me. Okay. This is going to feel a little bit sharp on your soles, but it's not going to hurt at all. Good. And on the other side. Okay, perfect. Okay. Okay, can you please look that way for me? to look this way for me? Okay, good. And I'm going to test your hearing with the tuning fork. I'm going to make some vibration sounds and I'll put it behind your ear. I'm going to need you to tell me when you don't hear this sound anymore, okay? Tell me when it stops. No. And can you still hear it now? Okay, that's good. Shit. Okay, go ahead and tell me when you don't hear the sound anymore. Now. And can you still hear now? You can. That's good. Alright, now I'm going to put it in two positions and I need you to tell me which position here is louder, position number 1 or position number 2. So this is position number 1 and this is position number 2. Number 2. Good. Oops. This is position number 1 and number 2. Number 2. Okay, let's go ahead and do that one more time. This is position number 1 and this is position number 2. Number 1. Okay, this is position number 1 and this is position number 2. Number 1. Good. And now can you please tell me if you hear a high pitch or a low pitch sound? High pitch. High pitch. Okay. Good. I'm going to whisper some words in your ears. Can you please repeat them back to me? Madpasmr. Good. I want my tingles back from you. Okay, wonderful. And can you please tell me what numbers I'm whispering? 1979. 1536. Okay, very good. And keep your eyes closed and tell me with which ear you hear the sound. Both. Left. Right. Both. Left. Right. Okay, wonderful. Cranial nerve examination was within normal limits. 1 to 12. No lesions. Cerebral cortex functioning properly. I recommend 3 weeks follow-up. Okay. Do you have any questions for me? Okay. Well, in that case, going to go ahead and let you get dressed again, and we'll see you back in the waiting room.